And we are live. Good morning, everybody. Welcome to the JAR Foundation podcast. My name's Ken Stearns. I'm the host of the show. I'm also the creator and the host of the JAR podcast. It's a traveling show. I'm running around the country, 111 cities, interviewing 444 people with questions from my book and human stuff. And in that
Mhm,
journey, I found, surprisingly, I was pretty surprised with the amount of mental health challenges people are facing alone, mostly,
mhm,
and kind of working through a lot of that stuff themselves.
mhm,
A lot of the people, of course, get help. They get professional help in either ongoing or they're in and out of it. But a lot of the stuff I've seen for me is manageable or preventable in some way through education or through some other earlier intervention and resources people can find early on. And so that's kind of why I started the podcast. I'm building out a foundation, a nonprofit around mental health to see what I can do in my little corner of the universe. And to kind of the to make sure that I don't say something too stupid, which is my normal approach, I'm actually going to be a little bit measured, and I'm going to bring in some people who know this stuff from all kind of corners, a 360-degree view of the business of mental health and helping people and putting it together. So my guest this morning, YooNa Kim, welcome to the show. And YooNa, I'm going to give you a free rein on the bio. I want you to kind of articulate who you are
mhm,
for the audience, and then maybe share a little bit about yourself, maybe the
mhm, mhm,
personal side, and then we can talk a little bit about professional, and then just observations about the industry and how we can do better.
mhm,
So,
mhm, mhm.
who's YooNa, and how did you end up on this show?
Hi, Mr. Storm. Ken, thank you so much for having me for this really meaningful show. My name is Yuna. I was born and raised in South Korea. So South number one cause of death for young people is suicide. Yeah, among the OECD country, and I was only counselor looking after 900 kids in international school setting, and that really gives
Oh
me
my
a
god!
like yeah
Whoa!
harsh reality. Like yes, so that's kind of how I ended up come to US, but that's the
Yeah.
kind of middle story. But I'll go back to my personal
Okay. Yeah.
side. So so when I was 11, my father passed away all of a sudden. It was an accident, and he
Mm.
has three kids. I was a middle child, and that apparently that life event changed my life history, my family story, like really dramatically. It was 11, like as I mentioned, there like it was not really mental health. I wasn't exposed to the mental health friendly environment, so I didn't know how to grieve. I didn't know
Mm.
how to love myself. There's just a no process at all. So what I did was just suppress my emotions, so I don't really acknowledge the
Yes.
sadness
Yeah.
that we didn't have,
Yeah.
and
That's
even our
more easy.
family, yeah. And it's Asian culture, like it's like at my like so for 10 years, we our
Just
family even did not talk about it, save our face. We just keep going, move on, move on, move on, and that kind of affect my own like the mental and the physical health. And
mm.
so at some point, like I was having a moment that I put so much pressure on. I need to be a daughter whom my father feel proud of. I want to be a stronger, like that, save my family. So I put so much unrealistic
Well, that's a lot of
expectation.
pressure. You're only
Yeah,
11.
11,
You're only
yes.
11, right? Yeah.
11, yeah. So that was really hard. Like I didn't even record it was hard, but it was just like automatically I should be
Yeah,
like
it's
that
automatic, right?
person.
It's
Yeah.
automatic. Yeah.
Yeah. But at the same time, seeing my father's body becomes ashes, like we cremated. So like his body, it just like asked me that really make me ponder about my life. Like everyone died, everyone.
Yes.
That's the truth, like a truth, like regardless your religion, regardless of your background, that's that we are not God. Like it's like we have a limited lifetime, and like like what will be your legacy?
At 11, you're already having a heavy self
Yeah,
conversation.
it was very heavy. and I become a really like serious little girl, like bring a lot of like weight of the life and weight of the
Yeah, that's a little heavy for
family.
11.
Yes, yes, yes. I don't think I had a. I mean, I had a very good childhood, but like it was a little bit heavy. So, but that guided me to whenever I make a decision, like what is really important to you. You're
Mm.
knowing that you're going to die anyway, like
Yeah,
your
yeah.
body. Yeah, yeah. So I think sometimes that questions that agenda could be light. I forget about it, but sometimes
Mm.
when I face challenges, like I always go back to that questions, like is it really meaningful
Oh.
to you and is it meaningful to your society? So anyway, so observing my family's whole story, like they react differently, reacting to the like loss of my father's.
Mm.
I decided to study psychology because I want to know myself. Well, I really wanted to analyze what's happening in this family, right? And I decided to be trained as a school counselor. But at the same time, I wanted to really explore different areas of like a psychology, law, international relations, like so I can have a more. I feel like that was a foundational like stage for my life.
Okay.
Um, so in order to become a like cool, successful woman in Korean society, I thought getting a job in multinational company is the answer. So I work for Microsoft. I work for the P&G Procter and Gamble for maybe
Okay.
2 3 years, and then I'm very hard worker. So I think I work as maybe I work 16 hours per day, like thinking about all different strategy. But it was a 1 point. Um, I think it was like a vice president of the Microsoft. He came to my supervisor and asked her like, "Oh, when I retire, let's make a coffee shop together." So for me, that was a really like shock, big shock, because like there are really successful people in this industry. Like if I were like, and I for me career was should be something related to life, like calling, not just the money making. So for me,
Yeah.
like why they are, if they for my like when I was 20 like 6 25, like if I were there, maybe I would do something related to the like their previous business, like computer software
Yeah,
or
yeah,
something. But
yeah.
like why coffee shop?
Coffee shop.
Yeah, so that really made me think, is this a, because if I work like 16 hours per day thinking about how can I sell the CRM product, is it the question that I'm going to ask rest of my life? If I, because like
Yeah.
we ask question to do our, to spend our right, like like for example, okay, like think about the fabric launching event. How are you going to
Yes, right.
increase the sales of like Korean market something? But I mean, that's a very important question for the business. But like for me, as I have that my personal history and personal like agenda, that was kind of conflicted. Is it really makes me become a better person as a human being? Is it related to my legacy? So, and
Oh,
I
yeah,
feel a little
you
bit,
got lost a little bit, right?
yeah, I got
So
lost a
you
little
kinda
bit.
woke up and went, "Oh, I'm on what I'm
Yes,
not on the right
yeah.
I'm on the wrong road."
Yes, yes, and like my body is extremely sensitive, and my body start to feel it, getting like some skin rashes. So it was a very, yeah. So there was a, and at the I think first time in my life, I decided, okay, I need to pause. I really
Wow.
need to pause. I need to give a like pause, intentional
Yeah,
pause,
yeah.
and really like look back on my journey, and
Yeah,
then
yeah.
make it be more intentional. So I decided to give my permissions to give a 2 or 3 month of just pause. It was a for me it was very hard, like having a because it seems like I'm stuck, but I determined to do that, and then I traveled to different country by myself just to figure out what will be the good next step. So that's how I ended up working and being a founding member of the international school in South Korea. We start with the 250 kids, but I think now we have a 1,200, and the school became the best international school in the world last year. So I worked
Whoa.
there for 8 years, starting as an internship, and I got promoted every year. And then I live in the dorm with the students. and that which allow me to really realize the harsh, like, what's happening in this country, what's happening for this young generation. There's no like mental
Oh,
health
it's,
support. Like it's like a
yeah.
one day there were like five students lining up in front of my office waiting to get the suicide risk assessment. And imagine I've done it like many years. Yeah,
Wow.
so it was like it was not really sustainable. I felt like this system is not sustainable because there are many people who are passionate like me, but
Hmm.
like I was only one counselor, 24-hour on call. If I do that, if I do that like for many, it's not. I will lose my passion. Like I got
Oh
burned
yeah,
out.
you will be burned out very
Yeah,
soon, very
and
soon.
then it's not. And I found that this can be universal experience, not just me.
Yes.
Like
Yeah,
who
yeah, yeah.
dedicated their life, like a helping professional, educator, or nurse. So I think that COVID kind of proved, like the situation, like a hard reality. So that's why I decided, okay, I'm a container of every other young people that I'm interfacing. That
Hmm.
means I have to be well taken care of. I have to be healed. I have to be well nurtured
Yes, that's right.
because
Yeah,
I am the container.
yeah.
That's my responsibility. So, and also I realize if I have a 10, I can give 10. But if I have only one, I can even give one to other people. So,
Yeah, nothing
okay,
left.
nothing left. So I need to fill in myself. So I decided to, I found an amazing program at Columbia University. It's a clinical psychology master's program. And I also wanted to focus on my own healing journey that wasn't fully healed from my childhood. So there was a mind and body spirituality mind and body institute
Okay.
um, under the clinical psychology program. So I decided to pursue that path. One thing I really liked about that program is that we see human being as a holistic being.
Okay.
Current medical,
I love that.
yeah, because
Yeah.
current medical system, current mental space is very clinically oriented. We just diagnosis. Okay, you have a depression. You eat there's a prescription. You
Here's a
go through
yeah,
this.
right. Here's a
Yeah.
prescription. Yeah.
So there's a so one is clinically oriented. Second thing is only 33% of the budget is focusing on the prevention. So me coming from the educational sector, yeah, it's a yeah,
That seems backwards to me.
yeah, yeah, 3%. Only 3% of money goes to prevention. That was come from. I went to the
Wow.
Cornell Medical Behavior Health Summit last week, and it was from the mental health commissioner in New York City. So he
I
is,
mean,
yeah.
side question on that. Do you think it's because there's more money in treatment than prevention?
I think there is a combination. I can
Combination.
speak about all these things like maybe a side note. Like we can please re-ask me again because there's a whole bunch
Yeah,
of
I'll come
questions.
back to
Yeah,
that. Let's come back to
yeah,
that.
please, yeah. So that's why I wanted to find a way. How do we really build the environment or space where young people can be fully seen and
Hmm.
fully heard, and just they can just be themselves. Nowadays people talk about like diversity, equity, because like there are so many different like buzzwords, but what I really think, one thing important, whatever we do, like intervention, prevention, like whatever we do, what's very important for me and for us is like a really like every individual celebrate who they are
Hmm.
and building healthy relationship with oneself. That's the key. If
You
school,
gotta
yeah, yeah,
you gotta love yourself.
yes, that's the key. Like
It's
the
key.
if I have a healthy relationship with myself, I have a good friendship with my friends, right?
Yeah.
I can always look after myself. I will treat myself with love and compassion.
Yes.
I will treat myself. I can be very reflective. I will give another chance to me. Like
Yeah.
it's that relationship really set the tones of rest of the relationship you have.
Yes,
It can
absolutely.
be a relationship with your family, relationship with your friends, relationship with your career, future,
Mm,
relationship with your past. Because if I have a good relationship, that's the inner resource I have. Yeah. And
agree.
like
Agree.
we constantly interact with other like aspect dimensions of environment, social environment, society, like environment or system. But if we don't have that relation, we can even reach out to the counselor. Even we can reach out to the family or friends when we are in need. We
Agree.
can,
I agree. I
yeah.
agree. Yeah.
So that's kind of I always go back to that, the sentence. Okay, build the relationship I have
With
with myself
self.
will set the tones of rest of relationship I have, and it can extend it different ways as well. So whenever I work with the children, students, or mentally advocate in different words, different capacity, like I always try to be a container so they can build that relationship with themselves.
Yes.
Yeah.
I think it's the key. And for young people, probably
Mm-hmm.
very difficult to get that self,
Mm-hmm.
even to find yourself, because
Mm-hmm.
it's such difficult ground to stand on, right? You don't
It
have a
is. It
real,
is.
sometimes they don't have that foundation.
Mm-hmm. Mm-hmm.
Um, so they do need this idea, this concept. Even the concept of this when I was younger would have been so powerful.
Mm-hmm. Mm-hmm. Yeah. Yeah. So that's so at while I was studying at Columbia University, I kind of expand my own interest in global mental health field.
Okay.
So which is kind of reflect on current clinical system. Like most of the clinical evidence, what do you call it, like gold standard or evidence-based practice. We always use evidence, right?
Uh,
CBT, blah blah blah. It's mainly tested by the male white people.
yeah. Yeah.
So when we implement it in a different population, different region, like it's not really always relevant. So
I,
it's a lens of scientific lens. How do we really pick the gold standard of like a pick the universal principle and apply to different community that honors their language, that honors their cultural background. So it was such
interesting.
a interesting and really like a fascinating experience for me to learn about how do we scientifically approach those. And I work in a global mental health
Sci-
effort. Yeah,
scientifically.
scientifically. Yeah, I feel like I feel like I have to keep this word because that's a Western language, like Western approach. And then I also need to be, how do I say it, that's the main framework that this society have, right? Like for
Yeah.
example, like even the spirituality, like it's like we have to, because the study I did at Columbia University, it's called like spiritual mind and body, but that was first Ivy League school that use the language of science to
Mm,
explore the different East and West wisdom, you know, wisdom of human being, human
okay.
flourishing. Yeah. So like meditation,
I
or
trust.
there's a different types of contemplative practice, Yeah.
Yeah.
Yeah. So that's that.
How
Yeah.
fun
Yeah.
for you. So this is kind
Mhm.
of an interesting concept, the idea,
Mhm.
the conversation, because you've got this very established practice that's created this fortress called the gold
Mhm.
standard,
Mhm. Mhm.
and they're all vested in that. And there's a lot of money in there to apply the gold. And now we've got this crisis emerging. A
Yeah.
lot of people coming into the space.
Mhm.
There's going to be a lot of challenges to the gold standard, I would imagine, right? A lot of like things popping out of the sides where they can't
Mhm.
control
Yeah.
everything because it's going to be a wide open market. I have a feeling there's a lot of different treatments coming.
Yeah.
Maybe we'll get some Eastern influence in this through meditation, through, mindfulness,
Mhm. 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 Yeah.
other
So
tools other than just clinical therapy.
Yeah, so there's a huge movement. I think it's starting in like I think it's 1980, 1990. The Martin Seligman, the former president of the APA, American Psychological Association, he created the field of positive psychology. So
Okay.
it's like the traditional psychology is focusing on the problem. Okay, so you have this problem. Let's figure out what is the cause, and that cause can be approached by neuroscience or like
Okay.
development side. Okay, you have attachment issues, so you have like development issues. There's so many like whole like psychology fields are actually figuring out what is a cause.
Okay. Which I
You
like.
just
That's good.
yeah, okay, and then because
Good.
we
Root
need to know
cause.
the cause, and then there's a problem, but it's like a so however that approach is kind of permanently focused on the problem. You are the problem, like, so you have to fix it. The concept of that whole process that you have to fix yourself.
Okay.
Yeah, so what I really liked about this positive psychology is, so you have the different like, so they build a VR character strength, which is composed of 24 different types of qualities, like spirituality, perseverance, about perspective, fairness. I think there are 24 different. So people
Okay.
just so those these approaches focus on their strength. So we identify top strength, and we are going to help you to thrive.
To thrive on that strength,
Yes, using
which
your strength
yeah,
is
which we
yeah.
now know is yeah, we know is the right way.
Yes, yes. So there, it's also a little bit controversial because it's a kind of, I've been practice positive psychology for 10 years, but some of who is coming from a traditional background, like it's
Yes.
yeah.
Yeah.
There's a new merging part. There's always conflict, and then we merge.
Yeah.
Like so
Yeah.
it's
Yeah.
kind of trend, but that's and they also build. I try to build the MBCT, like sometimes mindful based technique practice, MBC, so are like now there are different technique which aim to be a gold standard of this like a mental health field.
Okay.
Um, so many studies are going on, which is very promising. And I've been always in like try to mix of a traditional, because there are certain traditional techniques are proof to a certain like depression, or like, there's a like something we can utilize it. I'm not saying that that's wrong, but depending on the client, depending on whom you're interacting, there is a lot of I always appreciate the flexibility and the really knowing what they need.
And ultimately knowing what they need. Yeah, I think the flexibility, right? Not having some rigid set of,
No, yeah,
everybody, we put everybody in this box. I
no.
had that conversation with people. The thing I'm learning is that spectrum, right? Everybody's
Hmm.
situation is so
Yes,
everybody's got their own little DNA
yeah.
line on
Hmm.
the spectrum or whatever spectrum they're on.
Yeah, so we call it as like a mental health continuum. We see mental
Oh,
health as a
okay. Oh,
continuum. And so you
okay.
hit the very important concept.
Yeah,
So
okay.
knowing that our life is full will be not always like optimally happy stage,
Wait,
right?
wait a
With
minute. It's
yeah,
not always
yes.
beautiful.
Yeah. I mean, like it's like there's ups and downs. It's very subjective experience, but knowing that every like life will be filled with like unpredictable
Yeah.
events, ups and downs. But how can we embrace it? Embrace
Mm,
that uncertainty with grace. How do we? And that's coming from the like a relationship
yeah.
we have with ourselves, but
With
also yes,
ultimately with your
yes, yeah. That's
I mean,
kind of my
because
own philosophy, like so. Like please.
that's not a clinical. It's not a clinical fact.
No. But I think that there's that's kind of my personal like philosophy. But I think that they can be written in different ways. Like
Agree.
humanistic psychology, like described this way, like neuroscience described this way.
Yeah.
Like it's like a development cycle described this way, even like cognitive therapy. In order to do
Mm,
that, they use this technique, but for me it's very easy to understand, it's easy to explain. So that's why I've been using this concept. So so how do I go back? So the building of resilience, building like really enable, how do we really, if society can really make the environment, it
Mm,
can be go through it can be there could be different entry point. It can be clinics, it can be go through a school setting, it can go to
right.
community center, it can be go through even like a policy level, right? Where what are the what are the agent or actors or factors that
Mm,
influence our mental health? Yeah. So and how do we really collaborate together,
yeah.
because everything is interacted. So that's why I go back to the City Rise where I now work. So it's global mental health organizations. So we have a different branches in Kenya, India, Sacramento, Seattle, Bogota. So I was managing the mental health program across the city. Each like using the global mental health approaches, right? We
Okay.
have a
Okay.
global universal principle like theme, but how do we really making sure that works to that community? Or sometimes we listen to them the community first and it goes up, bottoms
Okay.
up,
Right.
and
Right.
top down, and where do we meet, right? So that has been a very interesting experience. Now I am in charge of building an inner development toolkit, like to help people to have a solid relationship with themselves. It can be cover. We can cover gratitude. We can talk about kindness. We can talk about hopefulness, hope. Like past,
Yeah.
because that concept is like actually proven by positive psychology. Like it surface past, present, future. We can
Oh,
reframe gratitude using the gratitude. We can reframe our past with being kind to myself, being kind to other
yeah.
people. We can make our this present moment more be more mindful, like really
Oh,
fully
for
present.
sure.
Yeah,
Yeah, for
right.
sure. Some of my guests on the podcast,
Mm-hmm.
my the Jar Show, it's interesting. They do reframe their past with their parents quite often,
Mm-hmm, mm-hmm. That's
and
her that story. Yeah.
they look back and they're like, I had a view of my parents when I was 20 or 30 or 40, and now that I'm 50,
Mm-hmm.
I see that they were doing the best that they could do with what they had. Like, there's a lot of
Yeah.
grace, a lot of
Yes.
grace given backwards, and they're like, yeah, I was bitter and I was this or that, and they sucked, and now I'm realizing life sucks and life's hard, and they probably did the best they could, and like I have a whole new appreciation for my mom and dad.
Yeah. Yeah. That's so true. Yeah. I mean, so
I like that
um,
going back and using that
yeah, and
loving
there's
yourself and loving
mhm,
then having an ability to judge somebody from the past.
yeah, yeah, and also like being hopeful for the future, because most of people who are suffering from depression, they have no hope. And I've been in that stage when
Yeah.
I was young. Like it's so hard to really observe who is suffering from the depression. It's so
Hmm.
hard. It's like you are just stuck in a one dark room. Like you don't want to wake up in the morning because like nothing will be changing. There's no even like glimpse of light. So that's kind of like a main. There can be a one main protocol. So we are doing a randomized trial control in Kenya and India. I think we are doing like 25,000 people for young people. So we are trying to bring it in the US context as well. So there's a very interesting research that's going on.
I love that.
Um,
I love this. The
mhm,
education. I love the education side. I think
mhm.
it's super powerful.
Yeah, so that's why I'm very passionate. I think my personal interest is intersection of prevention, like how to like in preventative approach in education sector,
Yeah.
but also like global mental health global mental health component of how do we really create the space that honors everyone's unique identity.
Hmm.
Yeah.
We're already
Oh
at
my
30.
God, this is like
It's
50. Okay.
how about some well, yeah, it's a great conversation, and I think you're at a good spot. You wanna because you almost kinda put a wrap on that. I think I got to where you're at.
Mhm,
I
mhm,
feel like
mhm.
we got your story out. Um, how about some closing thoughts for me? What do you
Oh
you know, I'm
my.
and this is really around, I'm trying to do, I think, access, cost, and
Yeah.
stigma.
Hmm.
So, access, cost, and stigma are three things that are challenge, but I think a lot of this can be solved through education. I'm kind of
Yes.
coming, and the people I'm meeting like you validate that, that we can, I think, slow people down from going down that path, allow the maturity to catch up,
Hmm.
because a lot of it is maturity. That's why old people are happy, because they're just old, and they
Oh
figure,
yeah,
and they
yeah,
just figure out life, that a lot of shit doesn't matter in life, and 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 they get a little bit more perspective and
yeah.
grace. Um, so, how about some thoughts? I mean, just some closing thoughts on the business. What can we do better in the education? What Any advice for me, as we kind of go into for the strategy phase?
So I think um what I okay, so there's a two thing. One thing is a lot going back to the business side. So
Hmm.
most of the data are privatized. So there we don't have any access to data. For example, when I was part of the building of venture capital backup,
Oh.
like mental health, we don't know what is retention rate, average retention rate for the patient. Apparently, can you guess what is the most common number of retention appointment rate?
Oh, no idea. Low.
It's a it's a one. Fifty
Yeah.
percent of patients just go one and they just drop.
50% go one time.
Yeah, and don't continue.
Do we know why?
It can be a there can be a various factor.
Yeah.
It can be a match with the counselors,
I was
right?
thinking
Or
the
it
match should
can
be the
be a
first.
yes, or it can be their financial issues, or it can be the severity of their issues, how urgent it is to be taken care of, or it's a whole mix of
Okay.
everything.
Yeah. Could be a
So
mix. Okay.
that's why I feel, how do we really create the first good impression when they reach
Yeah.
out to the
Okay.
counselor? That's very important. So that's why when I work in a school counselor, like I make my counselor office as like canteen, so everyone can
Yeah. Yeah.
come and sleep, and like
And
because
just chit
that's
chat. Yeah.
yeah, chit chat, because it's also related to destigmatize, yeah, destigmatize of the mental health issue, because if
The stigma. Yeah. Yeah.
yeah, yeah.
Yeah. The stigma. And if you go to a therapist's office, I mean, they're like, it's your worst nightmare as far as what you would imagine, right?
Hmm.
It's the couch, it's the desk, and if it looks and smells like, I would see going in there one time and going, this is not a normal environment. I mean, I'd never sit in a room like this and talk to somebody.
Yeah.
I don't know what normal, but I hope that remote therapy can be a better
Hmm.
fit.
Hmm.
At least
Hmm.
people have a chance they can try two or three people very quickly. It's a little bit more relaxed. You're not in the room. I
Hmm.
don't know. What do
Yeah,
you think
there's
about?
the for the virtual session and in person, there's like pros and cons
For
apparently.
sure, for sure.
Yeah, yeah. So I can talk about like for 1 hour, but
I'm
but I think the but definitely like having a telehealth, emerging of telehealth makes therapy really easy and accessible
yeah.
to the people who, especially who has a transportation issue, who are
Mm,
extremely busy, because they can continue as long as they have a willingness, they can continue. Yeah,
agree.
yeah,
Yeah, I think there's a lot of plus.
yeah,
Um, Una, thanks so much for being a guest and sharing your story. Very interesting. I learned something today. So I appreciate you for that. Thanks for shedding some light on. I got some new lingo, and it validated some of my thoughts around education.
yeah.
You really validated my thoughts around education. And there were two other things you said, which you didn't, or the love,
Mm,
loving yourself.
mm-hmm, mm-hmm,
So that's something I'm a big fan of. I
mm-hmm.
wrote can't really see it too well.
Dear
Let's
God.
see. Yeah,
The,
dear God, I wrote
oh,
a book.
I love name. Yeah,
Yeah, it's called. Oh, there we go. So I got
yeah.
this book called Dear God, and in it I talk about love. One of the chapters is about love and self-love and the
Mm,
critical
mm.
importance of self-love.
Yeah, yeah,
And we talk about the first part of the book is about book of self,
Yes,
which is
yes.
your yesterdays, your todays, and your tomorrow.
Yeah. Ah.
All the stuff happening inside here in the battlefield.
Oh, wow. Yes, yes.
And the last one you touched on that's in there is hope.
Yeah.
And I've got a chapter on hope, some letters. It's letters to
Mhm,
God.
mhm.
So
Mhm,
I got
mhm.
these questions about hope. And
Mhm.
I do think, wherever you're at on the spiritual spectrum,
Yes, yes.
on that spiritual spectrum, I think
Mhm.
if you're so far to the zero,
Mhm, mhm.
you're missing out on hope. You can't have hope without some faith that there's something else besides us.
Mhm, mhm.
And look, I'm not a religious person. I'm more spiritual.
Me too.
So my book comes from a spiritual place and a questioning place. And so, one thing I am realizing is that hope chapter, as I talk to people, like, hope is so powerful in this mental health
Yeah.
space. I had no idea that it was, the opposite of the self, your yesterdays. Hope is that thing, like you said, you feel like you don't have any hope. And
Mm.
what a terrible place to be as a person.
It is. It is. Yeah.
What a tough place. If you are in
Mhm.
that place,
Mhm.
I think first off, dial 988. There is a national crisis line, a
Yeah.
suicide line. People will talk to you, help you out. And if that's not your thing, reach out. If you're in a
Mhm.
dark place, likely there's somebody standing next to you in
Mhm.
that
Mhm.
dark place. In fact, it's a crowded room.
Mm, mm, mm.
Just put your hands out
Mhm.
and you'll find somebody there that can, kind of, you can hold each other's
Mhm.
hands.
Mhm. Mhm.
If you
Mhm.
can't
Mhm.
find the professional help. YooNa, thanks so much. We're gonna jump off now, but I'll see you back in the other room.
All right. Thank you.
Thanks, everybody.